And good afternoon, everybody, and welcome to COVID by the Numbers. I'm Steve Irvin, filling in for Katie Rammel today. It's our weekly look now at some of the numbers that we're seeing from COVID-19 and the spread of COVID-19, both in Maricopa County and statewide. And lots of stuff to talk about today. As always, I'm joined by Garrett Archer, who is our data expert, crunching all of the numbers for us. And we should probably start with some news here because we got some very encouraging news on the vaccine front. Governor Ducey today saying that by April 1st, we expect to have people in the 45 to 54 age group eligible for the vaccine. So if you're in that age group between 45 and 54, essentially 45 and up, you will now qualify, according to Governor Ducey, by about April 1st. So we're about 2.5 weeks away from that point. And then by May 1st, which is the deadline that President Biden put forward, saying he expects states to actually be able to vaccinate all adults by May 1st, the governor is saying we definitely have the infrastructure to do it as long as we have the vaccine supply to do it. He thinks that is a very doable date. And so the good news here is that within about 6 weeks or so, 6.5 weeks, I should say, we should have just about every adult eligible for the vaccine in the state of Arizona. Meantime, the state is getting a lot of money to be able to implement this. About $15 billion coming from the federal government, all thanks to that massive relief package that was just passed by Congress and signed by President Biden yesterday. Just to give you some perspective on this, the state's general fund, the part of the budget that the legislature typically haggles over every session and spends months haggling over, the general fund is about $12 billion this year, somewhere in that neighborhood. So we're literally getting more money from the federal government for COVID relief than the state typically gets in its general fund for the entire year, funding all kinds of agencies and so forth and so on. So we've got plenty of money to be able to do this. We know that the state health department, about half of that money is going to go to healthcare, but then the state health department itself is going to get more than $1 billion to continue to roll out the vaccine. Meantime, it's been about a week since the governor lifted restrictions on businesses, and on Monday, schools are expected, the schools that have not been open at least, are expected to reopen to some in-person learning options. Difficult to say the impact that will have because a lot of schools are already there. They're already offering those in-person options. And there are a handful of districts that had been remote since basically last year at this time. And some of those districts were planning on opening within the next couple of weeks anyway. So, and again, parents in those districts still have the option of staying in remote. So we're going to be talking a little bit about whether we'll see another spike from some of this lifting of the restrictions as we have in the past. Garrett, I guess we should start with, there's a lot of good news in these numbers here because we have seen case numbers dropping, deaths dropping, hospitalization, percent positive, all of those things that have caused us a lot of concern. We're seeing dramatic drops in those now, and especially in the last couple of weeks.
Absolutely. So what we're looking at today, 1,367 cases added and 55 new deaths. So what is that basically doing to our numbers? Well, since this is now a weekly show here, I'm going to go to the case dashboard itself because then we can look at it by cases by day. This is the, that was the zip code for some reason. Why I keep doing, sorry about that. That's my fault. All right, so now we're at cases by day. This is what's been happening for this last several weeks here. So you can see, obviously, this is where our highs are. This is where we've been seeing about in February 28th, at the week of February 28th, so the first week of March, 5,600 cases. The week after that, 2,000 cases so far. So we're still seeing about a 20% drop in cases week to week. And we're seeing that in our 7-day averages too. So our 7-day average right now is at 1,200. That's actually a substantial drop from the rest of this week. If anyone's been paying attention to the numbers this week, one of the interesting things that we noticed is that we had a lot of higher than typical numbers this week. But when we looked into the data, what we saw was that a lot of cases, about half the cases that we saw that were added this week, were actually added to the curve back in December. So this is basically what happens when a laboratory is put online in the electronic reporting system. They have a bunch of tests that they just drop into the system. and then it takes several weeks for the AZDHS to go through them and deduplicate any new positive cases. So a lot of the numbers from this week, even though sometimes it appeared that we were having increases, it was really an illusion, because a lot of those numbers, like I said, about 50% of what came in this week actually came in what would be called an inactive case. They were no longer infectious. They were not new. These were cases that were already, sometimes months old at the point that they were put in and declared a positive case. So all in all, the number's still looking very good. I'll go to the testing dashboard really quick just to show you what things are looking like right now with the testing. Let me see if I can get this a little closer. We are now pressing at 5%. That's up. Let's see. Oh, there it is. We're pressing at about 5% positivity rate right now, which is where we want to be. Obviously, we want to see this number continue to drop, and it has consistently dropped. And also, when you look at these numbers right here with the serology tests, they continue to increase. So all in all, everything is going in the right direction, and we're seeing that with hospitalizations as well. They continue to drop. Everything looks good in this respect.
Some people are probably going to say, well, we're also doing fewer tests. And although I think we've seen a little bit of an uptick in testing here after we kind of bottomed out in the last couple of weeks, but the percent positivity is really the more important number to look at. Regardless of how many tests you do, ultimately percent positivity tells you just how widespread it is in the population.
Correct. There really is. In fact, the interesting thing is when you look at this testing dashboard, this people tested, this is new people tested. So when we look at this is 23,124 new people tested over the last several weeks. When we look at tests conducted, this is duplicate tests. This is anybody that's taken a test. So all tests reported in yesterday, over almost 60,000 tests were reported in. So when we look at this at a weekly number, you can see that the number of tests we're doing every week is still in the 200,000 range, and it has been for several weeks now. So while it appears we might be testing less, what's happening is we're testing less new people. There's, people that are essential workers, healthcare workers, a lot of other people that are getting more frequent tests. They have to get tested multiple times. So that community testing dashboard, which is this one, when we look at this, the important thing to know is this only really rises when there's a significant demand in testing. We sort of have this floor here of about 70,000, 80,000 tests right now on a given week that are new people getting tested. Otherwise, we're not seeing anywhere near what we were with 200,000 people getting tested one week. That's only when the demand rises.
So when we start to look at some of these other numbers too, very encouraging numbers in things like hospitalizations, the number of people in ICU, we have seen dramatic drops in some of those numbers as well. And we've talked to a lot of healthcare professionals who say, boy, it's an enormous relief that we're just not seeing nearly as many people in ICU and nearly as many people getting really, really sick from this as we have, especially looking back to January and, of course, June of last year as well.
Right now, our hospitalizations are at about the levels we were in late October. Only about 10% of the hospital beds in Arizona right now are occupied by COVID-19 patients. We're still seeing about a 20 to 25% decrease in hospitalizations week over week. And we're about 80 to 90% lower than we were at the peak. That's what the decline has looked like. So one of the things that we expect, as we're talking about these openings, with the businesses going to full capacity and with the schools, first of all, we don't know what that's really going to do to the numbers. But what we do know based on conversation with experts and with our vaccination rates is that even if there is some sort of manifestation of a fourth wave, the likelihood is that it will not impact the hospitalization and death numbers to the degree that the January surge did.
And that's because there's just the people who typically wind up in the hospital are people who are more vulnerable, typically older people, and that's how we've sort of prioritized the vaccination process.
Yes, exactly. I mean, when we look at the vaccination numbers let's see if I can get this with Maricopa County. I'm gonna go to Maricopa counties and just show you this really quick. This will show basically what's going on with the age groups in Maricopa County. And here we are. So basically what we're seeing is that percent of residents who are vaccinated with one or more doses in these categories. So right now, about 30% of Maricopa residents that are 65 to 74 have at least one dose. About 24% of people over the age of 75 have at least one dose. So we're getting, day by day, those numbers are improving, and those are the people that are most impacted by COVID-19, at least having a severe reaction to the illness. And so as those numbers climb, we will also see even if there is increases in our COVID-19 numbers at some point, as long as these numbers continue to climb, we will not see a continued, we will not see the hospitalization and death numbers that we've seen.
So all good news there as well. We want to talk a little bit about one of the questions that we've been talking about and what people have been speculating on, and I think there's some logic to this argument, although maybe we don't have the numbers to support it, is that along with the number of people that we've had vaccinated, and correct me if I'm wrong, somewhere in the mid 800,000 range for fully vaccinated, and
about 800,000, yes.
And what 1.4 million I think we're up to now in Arizona, which would be at least one shot, right?
We'll be at 1.5 million tomorrow.
1.5 million, which would be over 20% of the state's population total.
21% of the population will have at least one dose. And obviously, because the Janssen vaccine has come in, as that ramps up, obviously the fully vaccinated number is going to increase a lot faster as well.
So when we take those numbers and then we look at the number of cases that we've already had, people who have had it and then have antibodies, which gives them, we assume, some protection. We're not sure that it necessarily gives them total immunity, but it certainly gives them some protection. We're into some numbers that are significant when it comes to trying to get to that herd immunity number of 70 to 80%. The problem is we don't necessarily know how to add those numbers up because we don't know how many people who've had it have also had the vaccine. Is that the way to kind of put it together?
That's a very good point. So we have about 20% or so of Arizonans that have either had the vaccine or have had COVID-19 at this point. So with those numbers right now, when we look at that, and that's the fully vaccinated number, and as that continues to climb, obviously we're getting closer to that herd immunity. Now that herd immunity is supposed to be anywhere from 70 to 80%. Hopefully we're seeing the vaccination numbers increase faster than the number of COVID-19s. And that's what we're seeing right now. The COVID-19 cases are only going up by about 11 to 1,300 a day, whereas the vaccinations are going up by 50,000, 25,000 fully vaccinated on any given day. So they are going up much faster at this point. My understanding, if you look at the calculations, is that we should achieve somewhere close to herd immunity as long as the trajectory continues by about mid-July. So that's with everybody, mind you. That's and not only is that calculation is also including people that are not eligible for the vaccination right now, which are people who are under 18 or under 16 for the Moderna vaccine. So we are, when you actually take the number a little bit, when you take those people out, we're going to get closer to that herd immunity a little faster. So, that's why when you were talking about when we first started that, the president said that we will be eligible to have people, all age groups, vaccinated by May 1st, or at least all eligible age groups. That looks like that should be a possibility. And, we could be looking at having essentially herd immunity in, June or July at this point.
Joanne's asked a couple of questions here. Where is the Johnson & Johnson vaccine available? We are getting more doses of that, and it's going out in a number of places, just like the Moderna and the Pfizer vaccine. Joanne also asked another question in the comment section here, and I don't know if we know this number, but when we talk about vaccination numbers, how many people are residents versus winter visitors? Obviously, it's the time of year.
We don't know the residents versus winter visitors. That's true. We can basically do some. I don't have the guesstimate for that. Because I don't know what the percentage of winter visitors are in Arizona. So we don't know that number, Joanne. As far as the Johnson & Johnson vaccine, we don't have any solid data right now as to where the J&J is going to be. We have some knowledge from Maricopa County that the J&J is being used for essential workers right now. grocery store workers, the sort of that essential services list that they put out a couple days ago. Excuse me, they put up a couple days ago. That's where the J&J is being used right now. If you look at the Maricopa vaccine location map, which I'll bring up right now, this is on their website in their vaccine dashboard. We have basically a bunch of locations all across the county, and M is for Moderna and P is for Pfizer. And you can see there is no J right now. So right now, Maricopa is not reporting any publicly available site like a pharmacy or a pod in which the J&J vaccine is available.
There's another question here I wanted to get. Well, we should point out with the snowbird question here, though, that if you live in the state and you're in that eligible age group, whether you're a snowbird or whether you're a permanent resident, you are eligible to get the vaccine. You don't have to go back to your home state or anything like that. If you're right now 55 plus and you are a temporary resident, you only live here, say 4 or 5, 6 months a year, you can still go get the vaccine. There was another question, and I'm trying to find it now. Kimberly has this. Is there a plan to get the vaccine to those who are immobile or just can't get out to get the vaccine? I think the short answer to that is yes. There have already been a number of efforts to get the vaccine out to people who may not be able to drive across town or drive out to the State Farm Stadium or something like that. And there are more of those efforts ramping up too, because we've talked about on our news and here on this program as well, the fact that especially in low income areas where people may not have a car, they may not have access to transportation, that sort of thing. Both the state health department and the county health department have launched campaigns to try to set up pods in places like schools, churches. They're trying to educate people, because that has been a problem. If I'm not mistaken, Garrett, that in some of the lowest income zip codes that we have, they also have some of the lowest vaccination rates.
That has been a problem. They have gotten much better. I will bring up the vaccine map right now. This is again Maricopa County. This is we do have vaccination data by zip code for the state, but the Maricopa County dashboard is specific in which it gives us the eligible population and the percentages in those specific zip codes. So it at one point you can see that the darker the color, the better the vaccination rate. And obviously when you look at this, you can see that the suburban north of Maricopa County has the highest vaccination rates. In Scottsdale, some of the wealthier zip codes over here. There's an exception to the rule in the Salt River Pima Reservation, which is about 80% vaccinated at this point. And also this area of the East Valley, which is, again, a fairly wealthy area of the East Valley. And this is a lot of places where a lot of medical professionals live in these areas. Now, as far as the most, the lowest income areas of Maricopa County, this used to be much worse. So whatever they're doing over at the state and the county efforts, they are working somewhat, because now at this point, we only have about 5 zip codes in the county which are under 35% or so vaccinated. Still very bad numbers in some of these places. 20% in Glendale, which is 85301. If anyone's been watching this knows it's one of the hardest hit zip codes throughout this entire pandemic. 8510017, only 25%. Here's another one right here, 85009, with only 14.5% in 85009. You contrast that with, say, Fountain Hills, obviously a very different income area, and more than half the eligible population in Fountain Hills are now vaccinated with at least their first dose. So, there definitely is a disparity, but it is improving, because if you looked at this map last week, this was not as good. There were a lot more of these sort of lower income zip codes here in this string that were in a much worse situation.
One of the commenters says that other cities in Arizona are far behind. Phoenix, Maricopa is not all of Arizona. My understanding is some of the other counties that we have in the state of Arizona are actually further along in terms of eligibility for vaccines, vaccination rates, and that sort of thing. Yes. We've got counties now in Arizona that are already vaccinating everybody in the adult population. They're not doing it in stages because they've managed to get vaccines out there. I think it was Gila County.
For example, Gila County is one they several weeks ago they've already basically open it up to everybody. We do have a map of the state, although I don't have context with it because it just gives us the total number of vaccinations in each zip code. So let me show you that really quick, and we'll just go through it very briefly. This is, again, the zip code dashboard for the AZDHS. Uses a slightly different metric. As you can see at this point, it's just by the number of vaccinations, first dose vaccinations. Now, we already looked up Maricopa County, so let's spend a little time in Tucson. You can see, just based on my knowledge of Tucson, these are the wealthy areas of Tucson right here, and they do have the highest rates of vaccination. That is something to consider. Let's go to, say, let's go down to Nogales down here. There's only 2 zip codes here, but this is a very Hispanic area of Arizona. About 4,700 here and about 5,000 vaccinations there. We don't have any data from the Navajo Nation. That's pretty typical, but by and large, just basically, if you know anything about these areas, you can see the places that are, the suburban areas outside of Maricopa County that are a little more wealthier, or the wealthier zip codes, are still doing the best in other areas as well.
And that's always going to be a challenge, is just trying to get those vaccines to people. And there have been numerous studies and polls and things that have been done, especially in minority communities, that there's less trust in the vaccine, less trust in the system overall to protect people. But I think that's, if I'm not mistaken, that's changing. I mean, we're certainly getting more and more people on board in terms of getting the vaccine. Although the governor, I think this morning, said that I don't know what poll he cited, but I think he said 55% of Arizonans are willing to get the vaccine. I'm honestly surprised that that's not higher, because when we've opened up these vaccine sites, people immediately grab those spots and immediately jump in there. So there's certainly a lot of people out there that want to get it.
If you look at, say, for example, anything on public opinion polling and how it works and how these behaviors sort of work is it's the best person, the best person to get someone to get vaccinated that may be questioning it is some other member of that family unit. So, as our vaccination rates continue to increase, and someone did say on here, I think Melody Salter said the Navajo Nation has the most vaccinated. That's actually quite true. The Navajo Nation does have one of the highest vaccination rates in the world. I think I haven't checked in about a week or so, but the last time I checked, it was second or third in the world with vaccination rates for the Navajo Nation. So, as the number of people continue to get vaccinated, and as it's shown that family members who get vaccinated are not having adverse reactions, you'll see sort of a cascading effect in which other members of the family units that may not have been comfortable at some point of getting the vaccine will change their mind, because in many ways there's this desire to return to normalcy. Now, of course, I know there's going to be people in the comments saying you're not going to get me to get the vaccine, and there's always going to be a certain percent of the population that is going to be against the vaccine. And that is just the way it is. That's why the herd immunity calculation is at 70 to 80% and not 100%, because they know that they're not going to get 100%.
We had Rivka, and I hope I'm pronouncing that right. Rivka. Do you know which companies are doing mobile vaccines? We know that there's an effort to do that. We just did a story yesterday in Sun City, where the health department was actually out there with sort of a golf cart drive-through for Sun City residents, and people were not only driving golf carts through, they were driving up cars. They were also just walking up to the site and do that. And there's much more of an effort to ramp that up, because and we've certainly seen efforts to get mobile vaccination efforts in places like long-term care facilities and that sort of thing. But Garrett, maybe you can do a better job sort of pointing people to, if you want to get the vaccine and you're looking for a place in your neighborhood, because we're expecting this to expand rapidly, especially over the next several weeks. The president last night said that we want to increase the number of pharmacies by about 20,000 nationwide, so that you'll be able to get it from your pharmacy, you'll be able to get it from your primary care physician. And we just ordered 100 million new doses of the Johnson & Johnson vaccine, and they're teaming up with Merck to get those kinds of things put together. So there's a lot of efforts to ramp that up, especially in the next couple of weeks if you still don't have it in your area. But state health department best resource for that?
Yeah, I would say the azDHS.gov website. If you go to find vaccine, I'll start from just the very beginning. So this is just azDHS.gov. You just go to find vaccine right here. Ignore this right here. I wouldn't even use this for anything. Just go all the way down to this map right here. It will show you all of the clinics and locations that are servicing the vaccine at this point. Anywhere in the state. That's why this is, you can go to the Maricopa County site for Maricopa County data, the one we've already shown. But if you're looking for anywhere else, this is a great resource to find vaccines in these areas. Now, I did see some people saying something. I think Margaret said something about prioritization of people who had
Underlying conditions,
healthcare conditions. So what's interesting is that what we know about how they're doing this is that the state is prioritizing whenever the state makes an announcement on an age group. Like, for example, in Tucson now, people who are over 55 can now go to tomorrow, you can now start going to the U of A site. When the state makes an announcement, it is for these state sites. When Maricopa County or any other county makes an announcement, it is for pretty much any other age group or any other, not age group, any other sort of eligible portion of the population. So they've really, the burden of getting to the people who have medical conditions is going to fall on Maricopa County and not the state. And I'm not saying that, I'm just saying when you are watching sort of the state make announcements, make sure you know that it's Maricopa County that's going to be making that announcement, or any of the other counties. Like, for example, in Gila County, we've already talked about everybody is eligible for the vaccine in Gila County. So, but you're going to want to look for what happens in the county level and not what the state says, because the state is continually going to be by age group because they are managing the pods, State Farm, Phoenix Muni, and that's what they're going to announce is those age groups.
And correct me if I'm wrong, but I know there's been an effort, or at least a push, to try to make for those people who are particularly vulnerable because of health conditions. There has been a push. I'm trying to recall exactly what happened with that push, but there's been a push, basically.
The legislature, correct?
Yeah, and then there's been and I think it had widespread bipartisan support to try to make sure that anybody who is over the age of 18, 17, 16 for one of the vaccines, to be able to get that vaccine as soon as possible. So that would be.
They're working through that right now, but that's right. That did change in the legislature this week. It was in fact Representative David Cook, I believe, was the one who was the spearhead for the Republicans, who did is starting the process of getting the government to the state pods, essentially the azDHS, to just basically make it eligible for anybody 18 or up that has a health condition.
Yeah, and people think that the legislature is bitterly divided over everything, but the fact is there are a few things they actually do agree on, and this is actually one of those things. There was a comment earlier. What happened with the flu? What happened with the flu is that we stayed socially distanced and wore masks, and the flu numbers are way down this year. I don't know if you've got a.
When they say that, obviously when people say what happened to the flu, they're trying to basically conflate the COVID-19 numbers and saying the COVID-19 numbers cannibalized the flu numbers. And the funny thing is, there's an irony in that, yes, they did cannibalize the flu, but not in the way that you're thinking. You're thinking that they're just taking flu cases and putting them into COVID-19, but COVID-19 is a much more efficiently transmitted disease. It has a much higher transmissibility than the flu does. And so because we were all social distancing, because we were wearing masks, there was no flu. If we weren't doing all of those things, we would have had COVID-19 and the flu. So it's not a conflation. They weren't cannibalized. The symptoms are not close enough so that a medical professional in a hospital is going to say, oh, you have COVID-19, when they in actuality have the flu. It's just that they're not that related.
Jackie asked a question here. Any news on if home health will be doing the vaccines for those 65 plus? We've already talked about that a little bit, but there are a lot of seniors out there who are homebound, can't get out of the house. But there's a lot of efforts as well to try to get the vaccine to them or get them to the vaccine. There have been a number of efforts, for instance, to provide transportation, so to get people to vaccine sites, and they're rapidly trying to move this out. I mean, the state as we said, within the next week or so, we'll have an astounding amount of money to be able to mobilize this even further. The health department alone, I think, is getting $1.3 billion, which may actually exceed its entire yearly budget.
Yeah, I was going to say, is that even their budget? Yeah.
Yeah, I mean, and overall, about half of the $15 billion that the state is getting is going to go to state and local governments to roll out the vaccine in various places. And so, it's not like they don't have the resources to do it or the infrastructure to do it. They will be able to get it out there and do that. And again, go to the state health department website, because they are certainly trying to get to all of those people who are particularly vulnerable, and that obviously would include people who are in that 65 plus range and people who are obviously need the vaccine almost immediately. We want to get to with schools opening on Monday, and again, this is the governor trumpeted this last week as a big deal, that schools need to offer in-person options by March 15th. For the vast majority of school districts in the state, doesn't really affect them that much, because they're already offering some sort of in-person option. It did impact some of these districts. Phoenix Elementary comes to mind. Phoenix Union comes to mind. Some of these districts that are in lower income areas that have been remote. But even though those districts were within a couple of weeks expected to reopen as well. But when we pull up the county map and we look at some of the latest numbers that we're seeing on the county map, keep in mind, just a few weeks ago, when we were looking at some of the criteria that the county was using in terms of recommendations to open schools, we were seeing, I need to sit up here a little bit, I guess, we were seeing all red, and it wasn't a good picture at all. Yes. That map has also changed dramatically with the drop in cases and deaths and so forth. And there's some very good stories in a number of zip codes.
Yes, absolutely. So let me see if I can I'm going to look at my history here and see if I can pick out what things did look like at one time. So let me go to, what do you want? Give me do you want an elementary school district?
Yeah, let's look at let's look at Phoenix Elementary, for instance. Okay, that's one that is going to be opening up on Monday. I think they were planning on opening up, if I'm not mistaken, by the end of March anyway. That timeline was pushed up a couple of weeks by the governor, but there has been concern, I know, in some of these districts that we're still in high transmission and that sort of thing.
So this is a brand new map scheme. Maricopa County did not update this map for about 2 weeks because they were reevaluating how they were going to do this map with the change in the governor's policy and the education department's policies. So they redid this entire map, but the underlying portion of the map, the cases per 100 and the percent positivity is still the same. So we're just looking at Phoenix Union right here. You can see Phoenix Union is still in the red, which means it's still considered high transmission with cases per 100. That being said, Phoenix Elementary School on January 9th of this year, its cases per 100 was at 945. So just that really gives you an idea. It is about 90% lower than it was, even though it's still in red. It was just an extremely hard hit elementary school district because of where it is, but it is also on the pathway of getting to this orange color, this substantial transmission, which then leads to moderate transmission, which then leads to light transmission. So, even the places in Arizona right now that are still in red are just over the line. And we can see this right here. Litchfield, we can see Avondale at 148, Liberty at 109, Buckeye at 110. All of these places just under the line. Same thing with the unified school districts. There's only 2 unified school districts at that point that are still in the red, and that's Queen Creek at 113 and Nottaburg at 109. Everywhere else is either in yellow or the orange. There is this one in blue, but barely anyone lives in Gila Bend, and so they're at 0. They have no cases detected last week. And then let's go to the zip code map, because obviously everyone loves the zip code map, and I understand that. Very interesting sort of numbers we're seeing here. We're still seeing the more of the red, the higher impacted districts still exist on the southwestern part of the city. We do have a couple here in Queen Creek. You can see Queen Creek still just over the line in some cases, but most of the red is in this line right here, which is just over the 60 freeway. We know this area it's a very heavily Hispanic area, very low income area, and this is just over the 10 freeway, goes all the way into Buckeye. But for the most part, the northern portion of of Maricopa County is either in the orange or the yellow. And we do have some blue districts, but again, these are very, very low populations in these blue districts. These 853, this Aquila, this one right here, this 85333, again, very low populations in those areas.
And we should point out a couple of things when it comes to schools. This is more of my area and something that I follow a little bit closely. First of all, just about any teacher that wants to be vaccinated is vaccinated at this point. And so teachers, a lot of them can go back into the classroom with a relative amount of confidence that they are protected. The other thing I think I want to point out is, and because I've talked with people in Phoenix Elementary and Phoenix Union, these two districts, which are on Monday going back literally after a year of being in remote learning. And when they go out and survey parents, they find that the majority of those parents, in at least the Phoenix Union case, and I think in the Phoenix Elementary case as well, the majority of those parents would rather be in remote learning. Part of the reason for that, and we did a story on this a couple of weeks ago, is that these are districts that really committed to remote learning. They didn't try to go back and forth, and so they really built a system there that at this point is functioning a lot better, certainly, than it did last spring. So you've got a couple of other. So it'll be interesting to see, I think, on Monday, just how many kids show up in the classroom.
Yeah,
realistically,
you're right. I don't really foresee a mass exodus of kids from remote to non-distance learning. As you said, we've already done this with in-person learning for quite some time now. I mean, really since last September, we've had school districts that have been have at least some sort of option for in-person learning. And so this is just sort of making it so that all school districts will have to have at least an option of in-person learning. But you're still not going to see a situation in which, say, 40 to 50% of the kids in a school district are going to shift from remote to in-person. There will be a certain percentage, but it's not going to be extremely high. So I don't really see it moving the numbers anytime soon.
Yeah, and I was talking to another school board member last week, and I'm going to go with, I think it was Osborne, if I'm not mistaken, who said, they did a survey. 60% of the parents wanted to come back, 40% of the parents didn't, and they're going to have that option if they don't want to come back. So, I think when you look at the entire landscape of these schools returning to in-person learning, it is not this mass gathering of people and a mass opportunity for the virus to spread that a lot of people think that it might be. We've got a lot of schools that are already offering in-person, and the ones that are going to be going online or going in-person, I should say, in the next week or so, may not have that many kids really showing up in the classroom anyway. So I'll be interested to see what happened there. Jeannie, I believe, Stockton is saying, did I miss the map for Pinal County? Can we talk about Pinal County?
Yeah, we don't really have a map for Pinal County, unfortunately, especially a school district or zip code map. We just don't have one. They don't give us anything. Maricopa County is the only county that really gives us something that is easily digestible and that we can use. So sorry about that, Gina.
We had somebody ask us, why do we need two news people to explain this? Well, if you don't need two news people to explain this, I might ask you, why are you here? Because that's what we're trying to do here, is to sort through these numbers and answer questions that people have. So Joanna asked if I had my shot yet. No, I am not eligible. I will be eligible, according to Governor Ducey, by April 1st. That's when he expects the 45 to 54 age group to be eligible, so I'll be eligible there. And as soon as I can get it, I'm going to get it. I have confidence in the vaccine, and certainly want to get it to get as much protection as I possibly can. Let's see what other questions we might have here. We can talk generally about Pinal County, though. I mean, we have seen. Are they in better, worse shape than Maricopa County? Because that's a county I know that we've done some reporting on there, and it sounds like they're rolling out the vaccine pretty quickly.
Yeah, let's take a look at Pinal County. We will just take a look at their data that were given by the AZDHS on sort of where they are and where they are with the vaccinations. So we're going to go down here on the AZDHS to the workplace and community locations. We're going to take a quick look at Pinal County on what things look like here in the district. You can see that Pinal County is well under 2 weeks so far for the COVID-like illness. Their positivity rate is now at 8%. And this is February 21st, so we know it's actually lower than that, 5%. And they are basically just under the cusp again as of February 21st. And so we know that as compared to Maricopa County, very little difference, a little higher than Maricopa County, but very little difference between Maricopa and Pinal County as far as our trajectory, which is not unexpected simply because Pinal County is so close. Now, as far as the vaccine itself, let's see if we can go back here. We'll go to find vaccine. There should be a link here in which we can go to vaccine phase by county. So, it opened up a new screen. So let me stop this. And I'm going to bring in this. Pinal County right now is prioritized to age group 55 to 64. So that's where they are. They're in the same situation as Maricopa County. As far as their numbers are concerned, I'm seeing if I can't really find anything to see how they're doing as far as their doses are concerned. Let's go look at their vaccine page really quick and see what it says. As you can see, I don't do as much with the counties anymore. There's a lot of work to do with the state, so I don't follow it as much with the vaccines. So we'll go to vaccine administration. We're going to go down here. Let's click on Pinal County. Come on, we can do it. So in Pinal County, the percent of people vaccinated is about 14.7%. You can see they are they're at about 100,000 cumulative. The number of total people, 67,000 that have at least had one vaccination. The fully vaccinated is 35,000. When we look at Maricopa County, we can see that we're seeing very similar sort of movement in the numbers here, although the percent of people vaccinated in Maricopa is a little smaller. It's at 13% rather than 14.7. But if you look at the curve here on how it's working, you can see sort of we had a high in March, just the late February, early March. You can see the vaccine numbers are dipping a little bit as far as the number of vaccinations coming out of the county. And we're seeing the same thing in Pinal County. We're seeing a slight dip in the numbers as well. So again, a lot of people have been attributing that to even the Texas, the freeze in Texas has really slowed down vaccines for the last couple of weeks. So it's going to be interesting to see if they pick up again as we get farther and farther away from that.
Last night, President Biden said that we can hopefully start gathering in small groups by the 4th of July, that we might seriously be on the other side of this or very close to this by the other side. The modeling that we have, does it match what the president is saying?
So as far as herd immunity modeling, let me see if I can find something for that. I had another model up. I didn't have my herd immunity model up. So let me get that model up really quick. I think as we've talked about, let me see if I can. Yeah, here's one. Here's a path to herd immunity. Let's go to Arizona. I'm going to use my MIT connection. It's not updated anymore, but it's still close enough that we can use it. So I'm going to pop this in and we will go to the county. This is the herd immunity estimates. We'll go to the county estimates. We're going to go to Arizona. Sorry, I picked on Arkansas on accident. Arizona. And this is what we look like for herd immunity here. What they're thinking right now. Let's see. He only has it till March. So it does look like as far as our path to herd immunity on this, let's see if I can get anything for you here. No, unfortunately, I don't have anything. Let me. I'll have to come back to you on next Friday, Steve, and see if I can find a better model for herd immunity, because University of Washington does not have a herd immunity model. So I have to see if I can find one for you that would be able to sort of take what the president said and affirm that that's going to happen. Now, in my conversations with ASU Biodesign, as they do a Wednesday, they do a press release every Wednesday or a press conference every Wednesday, their projections, although I don't have a visual of these, their projections do comport to the herd immunity being in July, mid-July. they think that we will be within that 70 to 80 threshold. Now, they do say that the caveat on that is we don't know what's going to happen with the UK variant. It is growing in Arizona. It's at about, their recent testing showed about 1 in 5 cases that ASU was testing was the UK variant. And because it is more transmissible than the standard variants, the California variant, whatnot, of COVID-19, it does mean that we would need to have a higher herd immunity threshold. So instead of 70%, it's closer to 80% in that case. And then, they still think mid-July, but, depending on what happens with the UK variant, that could change that trajectory. Now, that being said, even if we're not at herd immunity, it's still important to know that the vaccination cuts down dramatically on severe cases of COVID-19. So if numbers do increase, if we do see an increase in case numbers themselves because of the UK variant, we should not see a corresponding increase in hospitalizations and death. We may have a smaller increase in those areas if we do have another fourth wave, but it should be nowhere near what we saw in January. No expert so far I've seen is even remotely suggesting that we could see what we had in December and January at this point.
Lots of good news to pass on, and we are thankful to be able to pass it on. Thanks again for all of your great questions, and thanks to all of you who are tuning in here. Once again, if you need more information, go to our website. We've got a number of sections set up on abc15.com to help you find your way to a vaccine and find your way to a place where you can get that shot near you, find out if you're eligible as well. Thanks so much for all of you for joining us, and joining us tonight on ABC 15 News at 4, 5, 6, and 10.